Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc. I like to call this meeting to order for the International Fraternal Organization of Plantar Fascia Patients, IFOP. I'm a member, and if you're watching this video, I guess you're a member too. So plantar fasciitis is one of the most common causes for heel pain, and it's one of the most common things I see in my office. It's also one of the problems that respond best to conservative care. 90 to 95% of people have improvement without considering surgery. And that's why I want to talk to you about our heel pain relief program. We use custom orthotic devices to improve the function of the foot. What that does is decrease strain and trauma to the plantar fascia, decreases damage, and provides a long-lasting solution. So what can you expect when you come to my office? Well, there'll be an initial examination. We'll take a look at x-rays. We'll evaluate your activity level and your goals. And if it's biomechanical related, what we most likely will do is tape the foot, an athletic taping, which is on for 5 days. This is a great test and mimics what an orthotic will do. I don't really care how long this has been a problem. It's been a month, 5 months, 6 months, a year, 5 years. Within 5 days, if it's mechanical in origin, we should see some improvement. So your diary you're going to keep is going to tell us about the improvement you have on a daily basis. That gives us a really good idea of how things change. Not everybody's a candidate for orthotics. The diary will give us a real good insight if that's right for you. What I'm going to have you do is return in 1 week. We're going to talk about your results with the taping, and we'll decide if you're a candidate for prefab orthotics, custom orthotics, or even more aggressive bracing, which is a foot-ankle orthotic. The most common thread with all these treatments, though, that everybody will receive is a stretching program for the Achilles tendon. We have a video both on the stretching program as well as the stretching brace on my webpage that you might be interested in. So there are other treatment options for plantar fasciitis, but treating the cause is the most effective and is the easiest treatment. So let's fast forward 2 weeks. So when the orthotics return to us in 2 weeks, we'll give you a call and have you come in where the orthotics will be fitted to your shoe. We'll also talk about a break-in period, and that's extremely important. One of the most common mistakes my patients make is they accelerate the break-in period too soon. There's a lot of correction that needs to be done. The body has to accommodate really well. So once you get your devices, we'll see you again in about 4 weeks. And if there's any lingering distress at this time, we may modify the device. We wait 4 weeks because it takes about this long for the stretching program to kick in. And we want you firing on all 8 cylinders before we evaluate if there's any changes that need to be made. So key parts of the heel pain program, you'll get reminders through email about the stretching program with the link to the video. We want to make sure that you're wearing appropriate and controlling shoes. I'll see you again in a year to check up on the condition of the orthotic. The top covers have a lifespan of 1 to 2 years. If that starts showing wear, that's a new top cover. That's not a new orthotic, it's a refurbishment. I do like to evaluate the foot function in about 5 years. It's not so much that the orthotic changes, but the foot may change within 5 years, and sometimes we can modify the device or possibly go to a new device. So once the problem is resolved, there may be consideration for additional orthotics. If it's within 2 years of receiving the orthotic, your foot is in a digital form at the lab. They can make a new orthotic without having you to come in. If it's been longer than 2 years, I definitely want to create a new impression to capture if there's been any changes in the foot. So I'd like to close the IFOP meeting. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.